plastic materials was what health workers in Boko used to cover their bodies last weekend when they suspected an Ebola case. The Ghana Medical Association says the country is not ready, and this is contrary to what the health ministry has been saying. Now, the veterinary service is also concerned that people are still eating raw fruit bats in spite of several warnings. The service says it needs money to embark on serious public education. Are we indeed ready for Ebola?
The fact is that in the process of dressing, that's when you come into contact with the bodily fluids which contain the virus and you get infected. And that's how the human-to-human transmission then starts. So what we are missing up in this our campaign to either prevent the incursion of the disease into the country or contain it, should it, God forbid, should it come in, is that the human part of it is being tackled very well, and I think we should applaud the Ministry of Health for a very good job being done. But it is important that the fight should be holistic. It should be taken to the animal side. There should be education, especially to the general public, and specifically to the bushmeat hunters.
My name is Stephen Anti, and this is today's big story. Today's big story is brought to you in association with Nationwide PVC, suppliers and fabricators of high-quality PVC doors and windows. Now, Ebola has killed over 1,000 people in West Africa. Luckily, suspected cases in Ghana have all tested negative. But the Ghana Veterinary Service is still very worried about the continuous consumption of fruit bats and other bushmeat, despite several concerns. Now, let's listen to this short interview with Dr. Joseph Adongo Awene, a virologist with the Ghana Veterinary Service, and let's get back to the discussion.
Now, we have a thriving bushmeat market in Ghana, and it's not uncommon to see a lot of people by the roadside who have harvested bushmeat and are standing by the roadside selling fresh bushmeat. When I say fresh, these are bushmeat or freshly captured bush animals or wild animals, and they are selling them. And people buy them and they go and dress. Now, we are not trying to say that hunting is a bad thing, because the consumption of bushmeat in Ghana is very high. Almost 70% of our protein, animal protein in Ghana here, is derived from bushmeat. So to stop it is not the wise thing to do. But then it must be done with caution, because the threat is there. And it's an imminent threat. These bush animals will come in contact with the fruit bats. Monkeys will definitely come in contact with, because they eat fruits and the fruit bats eat fruit. So sometimes in the bush they come to have challenge and they fight, and there the transmission takes place. And when these animals are infected, they are the ones which are easily preyed on by the hunters, and then they are brought into contact. And the hunters, some will sell the catch fresh, some will sell it dressed. The fact is that in the process of dressing, that's when you come into contact with the bodily fluids which contain the virus and you get infected. And that's how the human-to-human transmission then starts. So what we are missing up in this our campaign to either prevent the incursion of the disease into the country or contain it, should it, God forbid, should it come in, is that the human part of it is being tackled very well. And I think we should applaud the Ministry of Health for a very good job being done. But it is important that the fight should be holistic. It should be taken to the animal side. There should be education, especially to the general public, and specifically to the bushmeat hunters, on the need to subject their catch for veterinary inspection. Apart from this, the chop-bar operators, and you can see they are dotted along the routes, the major trunk routes in our country. And it's a pleasure to always stop by and have some hot dish on your way either to Kumasi or anywhere by the roadside, and you prefer bushmeat. So these guys or these people who are operating the chop bars will also buy these captured animals or hunted animals and dress themselves. So they are also they are most likely to be exposed. So there is the need to educate them on the need to be circumspect in the handling of bushmeat cuts.
Well, that was an exclusive interview with Dr. Joseph Adongo-Awene, who will be joining us very soon on the telephone. And also the president of the Ghana Medical Association will be joining the discussion on how prepared GMA is to contain Ebola in the event of an outbreak. Dr. Adongo-Awene, good evening, sir, if you're on the line.
Good evening, sir.
It's great to
everybody listening.
Thanks very much for joining us on today's big story. Now, you have been speaking on some challenges in fighting Ebola. You feel that the human side has been adequately catered for, but the animal side, and you said something that is key. You said it is time for, well, all of us to subject our animal catch to veterinary inspection. That's like something that, I don't know, is our wildest dream. Is this possible to happen here in Ghana?
It's very possible. It is not any wild dream, if I may say. We have veterinary officers all over the country. It is just a simple idea of knowing that whatever you are using for your food consumption has the potential to transmit some infection to you. Not only Ebola, but there are a lot of infectious diseases that humans get from animals. So it is important for the general public to be aware that whatever you are going to use for food, if it is of animal origin, please get the veterinary officers to inspect it. We are not, the number of veterinarians in the system are quite low. We have a good number of veterinary technical officers also in the districts and in the regions, and a lot have been trained of meat inspection. So fortunate that we now, in this era, we still have the sama inspecting meat when they don't even know the animal when it is alive.
Right.
And how can they differentiate a dead animal from a live animal? But the veterinarians are well equipped and well trained to do that.
Yeah.
So it's simple.
Yeah. I mean, I don't doubt that. I don't doubt the competence of the veterinary officers to do this. But we do have such a vast land of natural resources that people go hunting anywhere. There are no proper regulations or guidelines as to what people should catch or hunt for and what they should do when they've got their catch. So, I mean, how well placed will veterinary officers be, for example, in a place like in Sawam? So if somebody goes to catch maybe grass cutter in a bush in Aduejiri, how is it possible that the person would be forced to subject this meat to veterinary inspection, or systems exist for that person to necessarily subject the meat to veterinary inspection? That's the kind of wildness I was talking about. It doesn't look like our systems are in place to make this possible.
The systems are in place. The problem is that compliance correlates to knowledge. Or what I should say, knowledge of what to do correlates to compliance. If the people are educated sufficiently to know that it is important to get animal products subjected to veterinary inspection, they will comply. And like you mentioned, at Aduajiri or someone, we have veterinary officers all over there. Even in the forest, the Dodo forest, in every part of the country, our numbers are not that big, but we still have a few who are effective, and we can handle the situation. The problem now is that a great number of the veterinarians in the field are handicapped. Handicapped in the sense that they are not mobile. And like you mentioned, the terrain is wide. The villages and the districts are wide. And how does one commune between these villages to do what he's supposed to do? The lack of transportation is the limiting factor. But the personnel are there, and they are well trained, they are effective, and they are active in their service.
Right.
And they will do it their way.
When we spoke to you earlier today, you did mention that your outfit needs support, funding support to embark on an education drive. Can you tell us about that?
Yes. If you look, I'm sure you have seen the poster that has been designed by the Minister of Health, or what we call the Presidential Committee on this Ebola. A very beautiful, elaborate poster which depicts all the do's and don'ts when it comes to preventing Ebola. There is the need to also go a little further, to do such a poster, to put in places like the chop bars. There are bushmeat markets dotted all over the country here. And previously we used to have a number of veterinarians there inspecting, but now most of the people who hunt this bushmeat or who harvest the bushmeat do not go there. But if they are educated, they need to go there, and we are financed the resource to do these posters and giving money to go out to reach out to these people and educate them, they will comply. It's a little support we are asking for, to go out to reach out to the people.
So have you made a formal request of such a request? And I wonder whether your agency is the appropriate agency to conduct a public health education campaign of this nature.
Yes, veterinary is a public health profession. All activities of veterinary is much more related to public health. In the Presidential Committee, we have a veterinarian present. He is, we live with the other people doing the general thing. But our activities are definitely our duty. For example, meat inspection, whatever you think of, and food of animal origin to be used by humans must be inspected by veterinarians. And we have a great number of public health specialists in the veterinary field. When you talk about public health, it is not only the human public health.
Right.
There's the veterinary aspect of it, and the medical officers will tell you. So it is also our mandate.
Right, agreed.
And
but
in this era of one well, one health, it requires that both of us should work hand in hand.
Agreed. But have you made such a request for funding support from the Minister of Health, for example, to help you with such an education campaign?
I'm sure that the budgetary allocation for this Ebola fight was done in conjunction with our representative there. But we are asking for a special funding to go into the special areas of bushmeat trade and education of people in the rural areas.
Right. So without these needed support that you're talking about in terms of resources and perhaps also funding, can you do anything different to help the situation at all?
Yes, we are already doing. We are already doing. For example, I'm speaking to you on Ebola. And there are many other people who are going around speaking. We have a wildlife veterinarian at the Wildlife Division of the Forestry Commission. He's doing his bit. He recently interacted with a group of bushmeat traders who came into town to actually seek his advice. We are doing the bit, but then to enhance us to do it better, that's why we are asking for a little bit of support.
Right, Dr. Adongo Awene, we're very grateful for your time this evening on today's big story. Let's go on to the other telephone line now and speak to the Ghana Medical Association. Dr. Eduse Poku is joining us. Good evening, sir.
Yeah, good evening, sir.
Now, from the doctor's point of view, can you say that Ghana is prepared for Ebola, and what further elaboration can you give us?
As I speak with you today, we don't think that Ghana is ready for Ebola. We are not prepared yet. Most of the things that we talk about are on paper, policies, but on the ground, we don't see anything. I'm even yet to see one poster of Ebola anywhere in town, both Accra and Kumasi.
What kind of preparation are you talking about? I mean, we do know for a fact that all the cases that have been screened have been negative. So we're not doing bad at all, in a sense that we don't have a single case recorded yet, whilst of course in our neighboring West African countries there have been thousands of cases. So what kind of preparations are you talking about, really?
Yeah, we are lucky that Ebola has flew over us. It is giving us warning. All our neighbors have it, and it's likely that we might have it. One, education is poor. The average Ghanaian doesn't know anything about Ebola. The health workers are not well trained, they are not well prepared, they are not well educated. The general public, there are no process. As I said, information flow is poor and poor, and at times there are conflicting cases. Yes, the few cases that we suspected, our preparedness towards testing them is high. I know that at some of the entry points, there are forms to fill and all that. On the ground, we talked about isolation areas. Isolation areas are not just near space. Isolation areas are there, there are beds there. Are the people there trained? No. The PPEs, personal protective equipment.
Yeah, but Doc, the health minister, when he spoke to the media yesterday, made reference to the fact that these isolation centers would be constructed, completed, and equipped in 2 weeks. I mean, they have made a commitment to provide these centers, so perhaps we should wait and see what they provide at the end of the 2 weeks before rushing to judge that we are not ready. Are you not being too harsh or stepping beyond your boundaries?
We are not being harsh. What we are saying is that last week or two, he said 2 weeks. Yesterday, he said 2 weeks. So we are getting to 3 to 4 weeks. When will that 2 weeks end and we see action? We are serious about it because health workers, doctors and other health workers are at risk. Ghanaians must be at risk. If we get the first case in country and runs through our system, it might be too late. We have cases, Nigeria very soon, they had one. The last time I checked, 10 people have been diagnosed and all that. What we are saying is that, yes, we've talked a lot. It's time to put all these stuff, all these policies into action. We want to see action. We want to see people trained. We want to see education go out to the average Ghanaian. We want to see the isolation centers, proper isolation centers. We want to see centers that will manage Ebola if we get Ebola in country. Yes, they said 3 centers. 3 centers where we are on the ground. Go to the teaching hospital, ask them physically, where is your center? Ebola is not ordinary disease that the average doctor or can manage. You need experienced health staff who are trained in the management. That's why we are saying that, yes, we are a little bit too slow and we need to quicken up our stuff.
A little bit too slow. That's we've heard it. But you are the medical association. I mean, you regulate the conduct and professional attitude or reaction or whatever of doctors. You have a role to play. What are you doing yourself as an association in all of this?
The role that we are playing is the role that I'm even speaking with you, telling our government to speed up. The role that we are playing is that we've instructed all our divisional chairmen to engage their regional ministers and their regional security councils and all their traditional councils.
So now what? You're acting as a pressure group?
Yes and no. The pressure group, advocacy group is there. And then on the ground, we've educated our members. We send out some flyers to educate our members so that at least they engage all the other stakeholders to make sure that we are prepared to manage Ebola if we get one.
And what feedback are you getting from this? I mean, you just told us that you're doing a lot of engagement with your people and then also appealing to government or asking government, kind of putting pressure also. What feedback are you getting? Is anybody listening?
Yes. Yesterday, the Ashanti Division and then the Regional Director of Health Services met with REFTE, the Regional Security Council. We took decisions. They are prepared to go and look for money so that we do education and we set up centers. This morning, the leadership of the Ghana Medical Association met with the Honorable Minister for Health, and he had lots of discussions. Tomorrow, the same Honorable Minister is meeting all doctors in Kumasi at a function where he's prepared, and you talk about Ebola as well. So yes, we are receiving positive vibes from them.
All right, Dr. Eduse Poku, we're grateful. We'll keep you on the line briefly and then get to the Minister of Health to get a reaction from them on the issues that you're raising, and hopefully you could rebut, you could react further when we get him on the line now. We'll take a break, and when we return, we will try and establish contact with Tony Goodman, the Public Relations Officer of the Ministry of Health. Stay with us. This is today's big story. Welcome back to today's big story. We're making frantic efforts to reach Tony Goodman, the public relations officer of the Ghana Health Service, but the Minister of Health, but we're not reaching him, and we're still trying very hard. If you just joined us, we have been talking about Ebola and Ghana's readiness and Ghana's preparedness for a possible outbreak. The veterinary service think that we as a country in our national response have ignored another aspect of the whole prevention, which is taking care of animal meat, and the veterinary service is suggesting that we find a way to subject our animal catch to veterinary inspection. We've been trying to put that issue to the Minister of Health, but we're not reaching him. So we'll bring down the curtains here and we will return with an interactive segment. My name is Stephen Enti.